Good afternoon. I'm Darrell Oviatt. This is my career research video for CE 300 at Winona State University. Wikipedia states, although the PI is responsible for the conduct of the trial, it has been said the CRC is the heart and soul of the research study. The purpose of this speech is to introduce and explain the career of a clinical research coordinator, to examine the 12 characteristics of this career path, some of the work, tasks, and activities, appropriate college courses and majors, physical demands, working conditions, job-related interests, required knowledge, some of the career preparation needed, hiring practices, wages, employment outlook, advancement opportunities, and some current job listings. Work tasks and activities. Basically to maintain required records for the clinical trial, such as case report forms, drug reconciliation, which of course would be important in a clinical trial, regulatory forms. Probably the most important form is the informed consent, and they maintain that documentation as well as actually work with making them and making sure that the patients will not be harmed. Adverse event documentation, quality assurance audits, protocol adherence, and they also track enrollment stats. Some more, they review proposed study protocols to make sure that people won't get hurt, confidentiality of subjects. You gotta make sure the benefits outweigh the risks for patients. Another big task is to make sure everyone involved in the study is qualified. And the research study is IRB approved, Institutional Review Board approved. Required degree. Mayo Clinic is a little different than some others that they do require a degree now in their new job settings. They require an associate's degree for associate clinical research coordinators, bachelor's degree for clinical research coordinators and supervisors. Through the research that I've done, associate clinical research coordinators, I couldn't find any other institutions that actually even have that job. But Mayo Clinic, it's something that they made. It seems like they made to get people in at the ground level with 2-year degrees to get them employed. Outside of Mayo, they require a bachelor's degree for employment as CRCs and clinical research associates. Management level requires a master's degree. And typically the degree is recommended to be science related, although most employers and most of the job searches I did not require it to be science related. They just basically wanted you to have a degree and some sort of clinical experience. And the experience expectations range from 1 to 5 years. Certification, I found 3 different associations that you can get certified. There's the Clinical Research Society, which is an all online program. The testing is also done online. They set up a web camera and watch you take the test, which is probably a little more accessible for some people instead of trying to get someplace, or the other ones all kind of had like centralized areas, the locations to do the test. So in this case, you could do it anywhere. So it'd probably be a little easier for some. SOCRA and the Association of Clinical Research Professionals were the 3 organizations that I could find that actually certify research coordinators. All 3 organizations have a minimum experience standard of 2 years. Unless you've been through an accredited coordinator program, then they lessen that down to 1 year. Physical demands and working conditions. Pretty self-explanatory. Indoors, environmentally controlled. Probably the hardest thing to deal with in this role is probably a continual sitting. And there is constant contact with others, and there is a considerable amount of stress to try to meet deadlines and make sure everything gets done so that people don't get harmed. Job-related interests. These 5 that I found were probably pretty typical. Helping people would definitely be something you want to be interested in if you want to be a coordinator. Investigative, because there are things you have to go find, and you also want to see if the drugs are actually going to help people and help mankind. Enterprising, conventional, and computers. Required knowledge. Medical terminology, pretty obviously computer usage, because there's a lot of forms to enter and different things to deal with. Word processing and spreadsheet are both Microsoft Word and Excel. Communication is definitely a key to this role. Not only do you have to communicate with coworkers in a business setting, but you're also communicating with patients. And if you're not good in the communication sense, it would be really hard to understand what a patient is trying to tell you. Written comprehension, because there's lots of things that you actually have to enter and write, and summaries of different things and adverse events that patients may experience. Ability to work independently, and also the ability to work in a group. There are considerable amount of times that you work independently, but there are other people you have to work with too, and people that you need to brainstorm with to try to figure out to make sure that the patients, again, don't get harmed. Career preparation, you have to build up some active listening skills, the medical terminology again, definitely reading comprehension, because there are a lot of notes to read and pill diaries that patients fill out and things. Writing, speaking. Critical thinking is another key preparation that you would need, because you would definitely have to think outside the box sometimes dealing with clinical trials. Decision making, there are a lot of times when things have to be done now and you don't have time to maybe ask people for help or brainstorm, where you have to make a decision on your own. College degree programs and clinical experience. The hiring practices, I couldn't find a lot of information on hiring practices, just my own knowledge of that Mayo Clinic uses group panel the interview system, where they ask you, different people ask you different questions and see how you react. Obviously, submission of resume and references would be hard to get hired if you didn't submit something. Wages, salary.com. The median annual salary that I found from salary.com was $55,440, which I found interesting, which means 50% of the employees make less than that wage. 10% would only make $41,000, and 25% would make $48,000. In fact, in Rochester, 55902, which would include Mayo Clinic here, the median pay for clinical research coordinators is $51,227 per year. Payscale.com, they had clinical research coordinator, CRC coordinator, I listed it as, with a starting pay with a median of $37,575 up to $70,851, and a certified, which means they've actually done SOCA or some kind of certification, they make about $3,000 more on the low end, which would be $40,000. But interestingly enough, on the upper end, they'd actually make a couple $100 less, as pointed out by Michelle, than someone that's not certified. The clinical research associate, which would be kind of like a monitor that comes to monitor the trials and stuff, they make median pays of $48,000 to $92,000. And a clinical research manager, $50,000 to $109,000. Employment outlook, of course, according to ONET Online, projected growth from 2012 to 2022 is 3.7%, which is slower than average. And the projected openings from 2012 to 2033 was only 13,700, so not a whole lot of growth in this position at this time. Advancement opportunities. I did include the Mayo Clinic, which would be the Associate Clinical Research Coordinator, hence that is what I am, and there are a lot of them at Mayo Clinic. The next step would be a Clinical Research Coordinator, which means you would need to get a bachelor's degree. I know they do recommend I believe it is 2 years experience, but that is subject to what they decide to do. Supervisor, above that is Clinical Research Coordinator, and that's also a bachelor's degree. And then you move up to like a Clinical Research Associate, which again would be like a monitor, and they need a bachelor's degree at least and 5 years experience, and some even include considerable amount of clinical experience as well. The healthcare manager would be above that, and they need a minimum of a master's degree. Current job listings, I just did a little bit of searching on that. MinnesotaWorks.net, I found a clinical research coordinator in Minneapolis. There was no pay listed, so kind of hard to gauge it with others. They did require a bachelor's degree, and you actually had to have 4 years of CRC experience. And they actually had it listed, they wanted SOCRA or ARC certification preferred. They did not list the third one, so I think those are the two main associations. Mayo Clinic jobs, there was 12 current openings, and they range from associates to CRCs and there was a couple of supervisor positions as well. Indeed.com lists 5,855 clinical research coordinator or related jobs. And CareerBuilder.com, there was 463 clinical research coordinator positions posted all over the country. In conclusion, clinical research coordinators are the heart and soul of clinical trials. It is the coordinator that makes sure the daily activities are done, patients are seen, and data is entered. Without the coordinators, clinical trials would not be a success. Clinical trials are essential to finding cures for mankind. These are the works cited. And does anybody have any questions? I thank you for your time.